I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
We define laboratory confirmed COVID-19 associated deaths as anyone who has symptoms of COVID-19, test positive on a COVID-19 test before or around the time of death. We do not determine causality, but that is our determination for public health purposes.
Yes. Agree. And my final question is, any guidance for us as physicians, and what role do you think it plays in filling out death certificates? I filled these out before for my patients when I've done death pronouncements as a resident. If a patient has CHF, they come in with a congestive heart failure exacerbation, but they also have a viral illness at the time. What should go on the death certificate? Is it clinical judgment, and what role do you think that plays in the numbers?
I think it's going to influence the numbers. I think you've got to make it clear. If someone obviously goes into it with acute respiratory distress syndrome and dies on a ventilator, that's coronavirus disease.
Sure.
You got to make sure it gets onto the death certificate.
Okay.
Dr. Fauci? I just want for Dr. Fauci or Dr. Birx. Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality. And I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? You hear from coroners that that's not necessarily the case. Or are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you there are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
No, I think there's so much focus now on coronavirus that, particularly if you take New York, which we all know is having a disproportionately higher proportion of the burden of the entire country is right now in New York. I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.
How about Mr. Vice President? Can I ask a question of Dr. Birx or Dr. Fauci?
Of course.
As you are both probably aware, there's a lot of misinformation, conspiracy theories out there about the coronavirus. There are some commentators who are suggesting that the number of dead are being inflated because they're saying that people who are dying with other issues are being listed as COVID-19 deaths. Perhaps you've seen some of this commentary. You may be too busy to see it, but it is out there.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded? For example, somebody who might die from a number of factors, but had coronavirus, are being listed as coronavirus deaths, and because of that, the number is being inflated.
That's a fair question.
Yeah.
And you might also speak about the converse.
Yeah, we've been hearing the converse too. That we've been hearing both sides of that. I think we've made it very clear. I think every time I've been up here about the comorbidities, and so most of the people, and we talked about the Italy data. The majority of the Italians who succumbed to this had 3 or more comorbidities. So this has been known from the beginning. So those individuals will have an underlying condition, but that underlying condition did not cause their acute death when it's related to a COVID infection. In fact, it's the opposite. Having that underlying condition and getting this virus, we know, is particularly damaging to those individuals. We don't know all the pathophysiology. I wish we did right now. We see a lot of vasculitis, where Tony and I came from. Dr. Fauci started in the vasculitides and Wegener's. So, these are things we have studied for a long time. We are trying to understand the pathophysiology, but what we can tell you at this moment, if you have asthma, if you have renal disease, if you have diabetes, if you have hypertension, these are pre-existing conditions that put you at a greater risk to having a worse outcome.
So, Jim, just to add a comment to that, because, having been through other serious issues, particularly the very painful early years of HIV/AIDS, when people talk about conspiracy theories, you will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. I can assure you, we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.